It's been high profile and very well respected for years.
But the Madison AIDS Network must change its ways or face losing some big money as critics continue to protest and the state continues to investigate. News 3's Linda Eggert is here now with the story. Linda.
Susan and Eric, after a year-long formal review of the AIDS Network, the state says the nonprofit still has problems with how it operates. And clients and former clients contend services could and should be much better.
Action equals life. Silence equals death.
Local residents living with HIV or AIDS and their supporters picketed in front of the Wisconsin Department of Health Services. They allege the state's been too slow on its oversight of AIDS HIV services and that services from the AIDS network aren't up to snuff. In fact, some say they have to drive to other cities for help.
It's important for folks to realize the fact that I have to drive to Milwaukee to access the same care and services I should be getting here in Madison, and there's no reason why they shouldn't be here in Madison.
So there's equitable funding, there's not equitable service.
At issue is how the AIDS Network, sponsor of that big annual fundraiser, the AIDS Ride, disperses and tracks services to its clients in a 13-county region in south central Wisconsin, including Madison.
In very late 2007, it came to our attention that there were some deficiencies.
4 on-site state visits since June of '08 have led to 38 directives for corrective action. But nearly a year later, almost a third of them have yet to be fully met. Because of that, the state has granted the network only conditional funding through September. AIDS Network Director Karen Dotson blames most of the problems on a new computer system. And she says she is very confident state and federal grants will continue to fund a referral for service system that works well.
You know, everybody has their own opinion of what they feel is important. But what I believe is that our quality of services have been extremely high. Our clients have been very satisfied with these services.
State and federal funding make up 40% of the AIDS Network's $1.8 million annual budget. The state says by next month it will verify full compliance on remaining issues like tracking medical appointments and transportation.
Now, Linda, is the network moving toward the so-called direct services, the more direct services?
Well, they have the referral mode, but they're sort of moving in that direction because Donson says due to the economy, the AIDS Network now hopes to open a food pantry by July and a dental clinic by late fall. It is slated to get $300,000 to do just that in the proposed state budget that's obviously under review right now.
Linda Eggert reporting.